Hi, I'm Duncan, licensed independent Medicare insurance broker. In this video, we're going to talk about how to sign up for Medicare Part B. We will talk about when we need to do it, where we need to do it, and how we need to do it. If you are new to the channel or haven't done so already, please subscribe to our channel and hit the little bell for notifications. That way you can stay up to date for new Medicare information and other informative videos. If you'd like to contact us, you can do so through our website, trustedbenefitsdirect.com, or call us directly at 800-910-3382. Before we talk about when to sign up for Medicare Part B, it is necessary we briefly talk about Part A of Medicare. More specifically, why we generally don't need to sign up for Medicare Part A. Part A of Medicare is given to us automatically on the first of the month we turn 65. The reason is we don't have to pay anything for our Part A of Medicare because we paid into Social Security for 10 years or more or for 40 individual quarters. Even if you have current coverage through your employer, your Part A of Medicare will go into effect and you will be receiving your Medicare card in the mail. Next, let's talk about when you need to sign up for Medicare Part B and when Part B is assigned automatically. Let's start with when you don't need to sign up for Medicare Part B because it will be done so automatically. Part B is automatically assigned to us when we start to draw on our Social Security before we reach the age of 65. Many people start taking their Social Security benefits early. Some start at age 62. What happens is, if you start drawing your Social Security benefit before you turn 65, the government will automatically enroll you into Part B of Medicare on the first of the month when you turn 65. Or it will enroll you a month early if your birthday is on the first of the month. Let me give you an example. If you were born anywhere from the second to the last day of the month, your Medicare Part A and or Part B will be effective the first of the month of your birthday month. However, if you were born on the first day of the month, then your Medicare Part A and or Part B will become effective a whole month early. It will become effective the first of the month, 1 month prior to your birthday month. The government will then start automatically deducting the Part B premium from your Social Security benefit. To sum this up, if you're drawing a Social Security benefit before you reach age 65, you do not need to enroll into Part B of Medicare. It will be done automatically, and the Part B premium will be automatically deducted from your Social Security benefit. This next section I will talk about is important. Your Medicare card will come in the mail and generally comes 3 months before your Medicare goes into effect. And what is important is there are many people that accidentally throw away their Medicare card. The reason being is they are getting bombarded by advertisements from Medicare insurance companies and they mistakenly throw it away because they think it is junk mail and don't open it. So 3 months before your Medicare will become effective, this is what you need to be looking for. It will come in a plain white window envelope. The logo for Health and Human Services will be in the top left-hand corner where the return address is. And the best way I can describe this is it looks like a line drawing of an eagle and also doubles as a human face as well. You should be seeing an example of this on the screen right now. If you are turning 65 and are not receiving Social Security payments, it will probably be in your best interest to sign up for Medicare Part B if you do not receive health insurance from your employer. If you're receiving health insurance from your employer, you should speak with the health insurance administrator to see if they require you to be on Medicare Part B. If you are retiring and leaving your group coverage or you are putting your Part B into place past the age of 65, you will likely not be able to do this online. You will need to contact Social Security and in all likelihood need to set an appointment to go see a Social Security agent in person. The phone number for Social Security is 800-772-1213. Be aware that Social Security is not open 24 hours a day, and there is likely to be a long hold time. Generally, the hold time is 20 to 40 minutes, and certainly can be longer as well. However, Social Security has a nice tool where they can call you. The link to the site is below, and it is to a very easy form to fill out. You need to put in your name, the reason for the callback, and your phone number. This is what the form looks like and what it looks like when you successfully put in your information. And then usually, I used it the other day, and it took them about 20 minutes to give me a call back. So go ahead and be on the lookout for a call from Social Security. My phone call came from a Texas area code. So I don't know if it's going to come from the same area code for you, but be on the lookout for that. In areas of the country where there are a lot of retirees, there can also be a long wait time to get an appointment. 2, 3, or maybe even 4 weeks to get an appointment. This is why it is important to plan ahead as much as possible and get this appointment set if you need one. If you are retiring, you will also need a form filled out by your employer so you don't have to pay the Part B late enrollment penalty. What you are technically doing is applying for what is called a special enrollment period so you can get your Part B of Medicare set up outside of your initial enrollment period when you turn 65. Also, this form will show you have employer coverage, also called group coverage, and will make it so you do not have to pay the penalty. Again, I make this easy to get the form. A link is located below this video where I have uploaded the form to my website. Simply print this out and take it to your health benefits administrator. It is likely they have seen this form before and will know exactly what to do with it. If you do need to sign up for Part B, we will now talk about how to do that. To make this easy, I have set up a website that will take you to the page you need in order to sign up. The website is www.partbnow.com. You would think you would need to go to Medicare's website, but for whatever reason, in order to sign up for Medicare Part B, it is not done on Medicare's site. It is done through Social Security's website. Now let's talk about the steps you need to go through in order to apply online. I have taken screenshots from the official website to give you an idea of how to get started and all the information you need. The easiest place to start again is my website, www.partbnow.com. You'll want to click the Medicare Part B enrollment button that is under the video, and it will take you to the page you need to sign up for Part B of Medicare. Here you will want to click the Apply Online blue button. The next page is the Benefits Application Terms of Service page. When you have read and understand the terms, click the I understand and agree to the above statement box and click the next button. On this page, you will want to click on the Start a New Application button, or if you are returning to an application, you will want to click on the Return to Saved Application process. Here you will want to click on whether you are applying for yourself or if you are applying for someone else. Next, click on whether you have a My Social Security account. If you don't, it will take you to this page for you to create an account. Below there is a link to where you can see our video on how to create a My Social Security account. If you already have an account, it will ask you a way to identify you. I have my cell phone in my account, and Social Security sends me a text message with a verification code. If you don't have your cell phone, I think it will send you a verification email. But anyways, after verifying your identity, it will take you to the Apply for Benefits page. It should already have your full name, Social Security number, and date of birth. Here you will need to answer if you are male or female, if you are blind, or if you have been unable to work. If you are applying because of a disability, you will want to click yes to this question and fill out some additional information. I clicked yes to this question because it wouldn't let me continue if I entered no because I'm not age 65 yet. In the coming pages, you will see they will be a little different than yours because I am technically applying for Medicare because of a disability here. I did not submit my application when doing this because I don't have a disability, but I wanted to be able to get all of these screenshots so you know what to expect. Next, you will enter your address, phone number, and best time to call if they need to contact you. Also, on the same page is your language preference. Next is your place of birth, and after you enter your place of birth, you will be given what is called a re-entry number. This is the number you will want to enter if you are continuing a saved application. Here is the screenshot from the beginning of the process and the page to enter the re-entry number. After you've entered the re-entry number and your Social Security number, it will then re-identify your identity again through a text message or maybe an email. Okay, we're on the home stretch here. The next page asks if you have used any other Social Security numbers or names. After this, it should take you to the review information page. Again, mine here is going to look different than yours because in order for me to get these screenshots, I had to pretend I was enrolling in Medicare because of a disability. When you get to this page, you will want to look for these check marks, as that will indicate you have completed each section. If something is missing, a red X should appear, and you can go back to correct any missing information. When you have all green check marks, and you are comfortable in doing so, you can go ahead and submit your electronic signature. Simply read the agreement, click the box here, and last click on the Accept and Continue button. After you click the Accept and Continue button, that should take you to a confirmation page you can print out if you like. That takes us to the end of our video here. If you have any questions about this or any other questions about Medicare in general, we're here to help. All of our services are entirely free. We help with Medicare supplements, Medicare Part C, Medicare Advantage, Part D prescription drug plans, protecting retirees' retirement, and much more. Again, I'm Chris Duncan, and it's easy to contact us. You can do so toll-free at 800-910-3382. Fill out our contact form on our website, trustedbenefitsdirect.com. If you found this information helpful, and you probably did if you made it all the way to the end of my video, please subscribe to our channel. Make a comment. I am curious to learn what you think about this subject, or share it to your social media like Facebook and Twitter, because, again, if you found this helpful, it is likely your friends would as well. We're always putting out information and important news and updates to help with things like Medicare Basics, Medicare Made Clear, Medicare Explained, Medicare 101, and much more. Thanks again, and we'll be talking with you soon.